Okay, our presentation is over flight nursing. My name is Gracie.
My name is Ava.
I'm Carly.
I'm Olivia.
I'm Amantia.
And I'm Phoebe.
The standards of practice of nursing outline the who, what, where, when, why, and how of the specific nursing role. This is what it would be for flight nursing. The framework would look who, flight nursing, are registered nurses with specialized training in emergency, critical care, and transport medicine. The what is flight nurses provide high level, specialized care during air or ground transport. They ensure patients remain stable and receive any necessary interventions en route to appropriate facilities. Where flight nursing occurs in helicopters, propeller planes, and jets, depending on distance, location, and urgency. The when is during high emergent, time sensitive situations, moments when rapid transport and advanced intervention can make the difference between life and death. And then the why is they perform this role to save lives rapidly, transport patients to the right level of care, and deliver emergency treatment when patients cannot safely wait for hospital based intervention. The community perspective for flight nursing helps close geographic gaps in healthcare by reaching remote, rural, or underserved areas, increasing access to critical and specialized medical resources worldwide. Person-centered perspective is that they tailor care to each patient's unique needs, providing timely, respectful, compassionate treatment during some of the most vulnerable moments of a patient's life. And then professional organizations supporting flight nursing is the Air and Surface Transport Nurse Association, which focus on advancing education, safety, competency, and professional excellence in transport nursing. And then the Commission of Accreditation of Medical Transport Systems sets and evaluates standards to ensure medical transport programs meet the highest level of safety, quality, and patient care. These organizations help establish the standards of care that guide and support flight nursing practice.
Okay, what are the responsibilities of a flight nurse? Flight nurses are registered nurses who administer high level of care to patients on an aircraft in transit to a healthcare facility. In addition to having similar responsibility to nurses in critical care and emergency medicine, flight nurses have further training that enables them to care for very ill or injured patients. Successful flight nurses are able to quickly assess, diagnose, and treat their patients with very limited time and resources. Flight nurses work in a variety of settings, but mostly in aircrafts. They respond to emergency situations at hospitals and trauma centers, as well as scenes of accidents. And they work with patients that range from just being born to being very old in age. And they are able to do tasks that advanced practice registered nurses do. Some of their duties include communicating with hospitals, like getting and receiving report. They provide safe transportation for their patients. They stock and maintain equipment of the aircraft by doing shift checks. They perform emergent invasive procedures. They record information for the patient's medical record. They collaborate with the flight crew and other medical providers. They accurately and efficiently assess patients in critical condition. They administer medications via multiple routes. They secure and maintain the patient's airway and ability to breathe. And they can resuscitate patients by administering chest compressions and many different types of CPR.
So, in regards of training and salary, um, I'll start presenting training and certification needed to become a flight nurse. So, each state has its own requirements for flight nursing. In addition, each flight nursing company has their own requirements for yearly education and certifications. To become a flight nurse in Michigan, a nurse has to have an active nursing license. Um, and most companies prefer BSN nurses. Most employers require at least 3 years of experience in critical care, emergency department, and pediatric critical care. These nurses will be working in challenging aircraft environments. Therefore, they also need to possess advanced critical thinking and strong physical fitness competencies to deliver safe and high quality care during medical transportation. Some certifications that flight nurses are required to maintain are basic life support, advanced cardiac life support, pediatric advanced life support, critical care registered nurse, certified emergency nurse, neonatal resuscitation program, advanced trauma life support. And then most companies require flight nurses to become certified as flight nurses within 1 to 2 years of their hire. And in some states and some companies in Michigan also require nurses to have a paramedic license as well. And then regarding their salary, pay for flight nurses depends on skill level, location, and how many years of experience they have. The median yearly salary for flight nurses in Michigan is about 95,000. And an hourly rate of that would be $45 to $46 an hour. And majority of flight nurses' salaries range between 74,000 and 115,000. However, the job market in Michigan is not very active as only few companies are hiring at a time.
So some challenges that flight nurses face are they work 24-hour shifts, they're on call for emergencies, and this makes it hard to plan for other activities and manage time outside of work. Also, other challenges being that you have high acuity patients, and some of them have less than a 1% survival rate on a regular basis. So this can just be mentally taxing. Some rewarding aspects are having autonomy and making own decisions and feeling confident, and you have your own work environment that is more managed by a nurse. And then you also have the satisfaction of feeling like you're doing something for patients who were not supposed to survive or helping patients that just need to be transported. Flight nurses collaborate with many members of the team, such as paramedics, respiratory therapists, physicians, pilots, landing crews, and more. They follow principles that align with the nursing practice. So the WHO, the registered nurses, and advanced practice registered nurses comprise the WHO and have been educated, titled, and maintain active license to practice nursing. The what is nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, facilitation of healing, alleviation of suffering through the diagnoses and treatment of human response, and the advocacy and care of individuals, families, groups, communities, and populations, wherever the patient is in need of care, whenever there is a need for nursing knowledge, compassion, and expertise, and why, which is the profession exists to achieve the most positive patient outcomes in keeping with the nurse's social contracts and obligation to society. The nursing scope and person-centered care of flight nursing is they manage a wide variety of injuries and illnesses from birth to death. Flight nurses have a wide scope of practice, wider than a bedside RN, and sometimes they do procedures by themselves that are controlled usually by physicians or APRNs. Like they do chest tubes, intubation, emergency medication administration, ECMO, and more. Flight nursing has a strong alignment to the nursing scope by correlating with examples such as strong assessment and critical thinking, interprofessional collaboration, providing critical care and emergent care, all of the following which specific protocols and regulations, which follow specific protocols and regulations. Flight nurses provide person-centered care by providing communication to the patients everyone involved in care, and they provide holistic and collaborative care in emergency situations. They respect individuals' needs and wishes and do the greatest amount of good they can in the short amount of time they care for a patient.
Flight nurses often encounter some of the most critical and life-threatening situations. Because of their ability to provide expert care and save lives in these high-pressure environments, they are highly valued and respected. With this role comes significant responsibility as flight nurses are typically the only healthcare provider on the helicopter and must make all decisions regarding the patient's care. This level of independence offers a great deal of autonomy, which many nurses find rewarding. Another advantage is the efficient work environment. Everything is needed within arm's reach, eliminating the constant search for supplies common in hospital settings. The profession also allows for flexibility as many flight nurses balance additional nursing roles alongside their flight duties. And lastly, the ongoing demand for emergency transport ensures strong job security in this specialized and essential field.
Okay, so as far as personal interests, I personally have an interest in looking further into flight nursing, and a few reasons why I want to be a flight nurse is because of the acuity of patients. Patients aren't just life flighted for no reason. It's usually for incredibly critical situations where this is life or death for the patients. There's also a little bit of flexibility in the scheduling as it's usually 24-hour shifts, which could be a nice way to go about having your schedule set up. And lastly, autonomy of the position. There's no RT, there's no critical care physicians. It's solely up to you to keep this patient alive while transporting, and that's something that I think would be pretty cool. So, as far as personal experience, I have an internship at a comprehensive stroke center at McLaren and Flint, and we're the only comprehensive stroke center from north of Flint. So we get a lot of patients from northern Michigan and the Upper Peninsula. And they're flown to us for neurointerventions for stroke management, and they're flown in by North Flight Aeromed. And having the experience to kind of interact with those flight nurses and get a little bit deeper perspective of what they do has been a really cool experience, and it's inspired me to look further into seeing what that job is all about.
And then my personal interest in flight nursing stems from the continuous learning aspect of the job because, like Carly said, these are very high acuity patients. And so there are always things to learn and challenges to think through and overcome, which will just hone your nursing skills even more. And I also think that it could be a very rewarding job because you're actively involved in saving somebody's life. And that is a really cool thing to be a part of. The experience that I have with flight nursing is through my externship in a surgical trauma and cardio ICU at Henry Ford Macomb. And it's pretty limited, but one of my patients was flown to a higher acuity hospital downtown by the MedStar Life Flight helicopter. And it was very interesting to see the process of condensing all the medical equipment and several drips down to a really small amount of things to prepare the patient for travel. So that definitely piqued my interest in flight nursing. And then these are our references. Thank you.